Good afternoon, everyone. My name is Marissa Weiss, and I am from the Lymphology Marketing Team here at Jobst. Thank you for joining us today for our webinar series. Our topic is nighttime garments and will be presented by Margaret Hopkins. Margaret is the National Clinical Manager for our vascular and wound care products. She is a close-trained, certified lymphedema therapist and has worked with clinicians and patients for over 25 years. We hope you find this webinar interesting and informative. Please note that this is a recorded session, so we will not be taking questions at the end. However, you can direct any questions to me and I will help get them answered. Additionally, we hope you join our email blast to find out about our next monthly webinar. Thank you again for joining us today, and I'll pass it over to Margaret.
Thank you so much, Marissa, and welcome everybody. Thank you for joining, and let's get started. Today we're going to talk about nighttime garments and simplifying. How do you pick a nighttime garment? What type of nighttime compression should your patient wear? What type of garments are there available for use? And how do you choose the right garment for the right patient? So we need to make sure that the patient understands why they need them so that they can make this part of their home routine. During CDT, complete decongestive therapy, the patient is in finger wraps for 24 hours. When we get to the maintenance phase, however, many patients get a daytime garment, but they may not understand or be recommended to get a nighttime garment. So why do they need nighttime compression? Compression in and of itself, I think, can be very confusing for patients. So they have daytime garments, nighttime garments. They may have a compression pump. They may have a Velcro wrap. They might be using kinesio tape, foams, or pads. They have so many choices and so many alternatives that we need to help simplify their home program to something that's easy to manage and that does not interrupt their daily routine too much. Patients need many modalities to help control their condition. They may not need the modality each and every day, but many times we know that these patients can fluctuate or they can have certain circumstances that come up that make their condition more difficult to control. And it's important for them to have the tools in the toolbox so that they can address these issues when they happen and understand what they need and when they need it. Patients are also looking themselves. They want to be educated. They want to know what they should be doing, and they need support along the way. These are just a few of the groups that I've seen on Facebook, and I think it's wonderful that patients have these type of support groups out there and to share their story and hear other stories so that they could be inspired and encouraged. It's also important for the patients to know that when the patient on one of these groups is talking about success that they may have had with a modality, that same success may not happen for them. Each lymphedema patient needs to understand that they are unique and that their treatment plan is unique to them. So what works for one may not work for another. I think that's a really important message that we have to make sure we bring home with each and every patient. Night garments different. I've had patients tell me that many times they just use their stretched out garments at night to sleep in. That's not really ideal, and that is not a garment that's designed to wear at night. Day garments are meant for use during the day while the patient is up and moving around to control their swelling and to work with them while they're in motion, not sleeping. Night garments are designed so that they're safe to wear while sleeping. They have a low resting pressure, and they keep the patient contained at night. Many of the night garments are also designed to help soften fibrotic tissue with uneven surfaces or foam. I found it interesting that this one study that I was looking at had this quote from patients that nighttime compression reduced the swelling and was associated with less pain and better sleep. I think that's really important. Patients do experience pain and they need to get their sleep at night. When they are not compressed, many patients have pain and it does affect their sleep, which we all know if we don't get our proper amount of sleep, that affects our whole life. I'm briefly going to go through the 4 stages of lymphedema because I am going to refer to these in the coming slides. So stage 0 is that non-visible latency stage. Typically, swelling is not really noticeable. Stage 1 is a mild, where pitting is still occurring. Swelling may go down with elevation. Stage 2 is non-pitting. Skin and tissue changes have already begun to happen, and we can see the swelling on that patient. Stage 3, the limb or affected body part becomes large, misshapen, and skin changes are already happening, as well as changes in the contour of the limb. So it's important to understand which stage the patient is in to select the proper garment. So let's move on. When we address the upper extremity, we have many options. Know that multi-layer bandaging is always an option for nighttime use. We use it during their treatment phase. It can also be used in the maintenance phase. However, it is very difficult for many patients to bandage themselves or to find the patient who wants to continue bandaging themselves. It is a difficult process and time-consuming. So many patients are looking for a different alternative. At Jobst, we have the Relax garment, which is a unique garment we'll talk a little bit more about coming up. We have the Joby Pack garment. We also have our Pharaoh Velcro wraps. All of these are available for use and are safe for the patient to use at night. This was an interesting statistic as well, that about 25% of breast cancer patients will develop lymphedema, even though surgical techniques have dramatically improved. And I've seen this, being around as long as I have, it's kind of interesting to know that these statistics have not really changed over the last 10 years. For better or for worse, that is still the statistic that we see, about 25% of patients. However, I've seen with surgical techniques, different types of lymphedema are occurring now, and we'll discuss that coming up. Lower extremity, the same choices are available. So we have the Relax garment, we have Joby, we have Pharaoh, and we also have the multi-layer bandaging. Again, bandaging is time-consuming for patients, but it is an economical way for them to continue their home treatment and maintenance phase with the bandaging they already have from their treatment phase. Primary and secondary lymphedema both require compression. And as we know, lymphedema is a progressive condition that requires good self-management. We need to make sure, again, that patients have all the tools in their toolbox that they need. I do want to address chest compression. Most patients who have chest wall and breast swelling will need to address it with some sort of pad and compressive bra. Jovi pads provide a lot of different options, ready to wear, and custom options for the patient. These pads can address different areas where swelling can occur. They are made with a nice, soft, organic cotton, and they have a two-blend foam. These pads have continuous flow channeling as well to be used under a compression bra like the Balise. These garments and pads in concert together, most patients do not want to wear them during the day, which is why I bring them up on the nighttime compression. I do want to make sure that patients who have this type of swelling, even if they don't want to wear something during the day, that they know they can address this at night. Another one type of swelling that we need to address at night is typically the head and neck. Most patients will only wear their garments at night, and you could see some different options here, and obviously why they would probably only wear them at night or around the house. Again, with head and neck, when the patient is in a supine position, they don't have the luxury of gravity helping to drain them. So a lot of head and neck swelling gets worse during night and overnight. So when they wake up in the morning, they may feel very full. If they wear appropriate garments at night, this will help alleviate that. This was an interesting study done at Vanderbilt, and actually a staggering statistic. 75% of patients had some form of late effect lymphedema of the head and neck region after undergoing treatment for a head or throat cancer. And you can see it's not only debilitating in terms of range of motion, it's also debilitating, I think, aesthetically for the patient to completely see their appearance changing. So we can't discount the aesthetic part with any type of lymphedema. I think it's a significant change that the patient has to deal with. So the more we can give them to correct this, I think the better they will be and the more committed they'll be to the maintenance. So what are some patient complaints about wearing nighttime compression? Many patients complain that they are too hot. And that can be true. There are ways to combat that, and we'll discuss that. Patients say they're itchy, that they can't sleep with the garment. It's too tight, it's too much work, they're too tired. They have many, many different complaints that come up. Obviously, it is a really big commitment for lymphedema patients to commit to daytime and nighttime garments. And that's why I always go back to maybe it's not every single day that patients use all their modalities. Many patients have shared with me about compression pumps or night garments that they have them, but they really don't like to use them. They don't like to sit for an hour or an hour and a half using their extremity pump. They don't want to wear the garments at night because they are too hot or too bulky. and they get in the way. So I think it's really important that we choose one where we're going to get the most compliance and it's going to do the most good. I did want to put some of these comments up from actual patients after using the Jobst Relax garment. This was during our initial rollout, and we got some wonderful feedback on this new product. Patients saying, I love it. I think it's wonderful. I feel like it's keeping my lymphedema at bay. Now I'm able to sleep on this side as well as on this side. It's cooler than one of my other garments. This is just comfortable. I love this other one. I just feel like this is my angel watching over me. Now, not every patient's going to feel that way, but it is pretty amazing to think that we could get these kind of reactions from a garment. And a garment like Relax does increase compliance. And we have to consider compliance being a very important part of the home program for patients. So let's go through the Jobst Relax garment. Typically, we're recommending this garment for mild to moderate patients. Maybe that's stage 0 to stage 2. And there's some unique features to this garment. You can see this side view, which is pretty amazing. It kind of highlights that spacer technology that we have in there. So we do use a textured surface and the monofilament layer to create differential pressure areas that help stimulate lymphatic flow, but it's also very low profile. So patients really like that in comparison to other choices that are out there. In addition, it is flat knit and it's custom made. So the flat knit technology allows for this garment just to be worn alone. It doesn't have to have another layer on top of it to get good compression. We also include Coolmax yarns and advanced knitting techniques that help increase the breathability to keep patients cooler and more comfortable. I can share some stories that I had with the initial rollout. I covered Arizona at the time when we first released Relax. And as you all know, Arizona can get very warm and it is very hot there. Like we're talking 113 degrees, 120. And patients that were trying the garment, even in the summertime, were giving very, very positive feedback, particularly bilateral patients, where the bulk of a foam garment is very difficult to wear on both legs. Now, one limitation of the Relax garment is that it comes in styles for the arm and the leg. There are not options at this time for the trunk or for the abdomen. So we're not making a biker or boxer or chest compression at this time. So you can see here we have a knee high and a thigh high, an arm sleeve and an arm sleeve with a gauntlet. It also does not have a glove available at this time. So we're going to look at some patient examples. So you can see here, patient 1 has very mild swelling, but does notice a lot of heaviness in her arm. So she wears a day garment as well as a nighttime garment and is a perfect Relax candidate. She wears one just to the wrist and really does not have any issues with her hand at all. Patient 2, you can see, does have hand swelling. Her swelling is a little more pronounced, and she does have swelling into her hand and fingers. Now, one tweak we had to do with this patient was when she was wearing the Relax garment, she also needs to have a glove for nighttime use. So she wears that in addition to her Relax. Patients 3 and 4, you can see have lower extremity swelling. Both of these patients have a venous component as well, but they also suffer from lymphedema. These patients both have chosen to wear Relax just to the knee. Could they benefit from full leg compression? Probably. They do wear it during the daytime. However, here's where the compromise comes in. So we'll choose patients who can wear the garment, but then we also have to give a little bit. Do they not want to wear the full leg? Can we get them to wear it at least on the lower leg? And that was the choices for them on patient 3 and 4. So what about our stage 2, stage 3 patients? Jovi Pack is really ideal for the moderate to severe patient. Jovi provides an ideal solution when fibrosis is present. The foam that's used actually can take the place of the multi-layer bandaging, yet be just as effective. The Jovi product does require a Jovi jacket for the optimal therapeutic benefit. What the jacket does is provide a little additional compression on top, and it helps that foam create this differential pressure points so that we're getting lymph to flow towards the alternate pathways through this channeling. Here's some highlights about the Jovi product, which I think are pretty unique. The classic Jovi lower extremity and upper extremity has Polartec fabric, which helps move moisture away from the skin and helps with the quick drying of the fabric. That is one thing you will hear from patients when they do launder these types of garments. Many times they take a long time to dry and they only have one garment. So this helps to have the Polartec fabric that quickly dries. The yarns that are used are smooth and comfortable. The 4-blend foam or 2-blend, whichever you choose, if you tend to choose the slimline, and the continuous channeling technology. Here's some patient examples for the Jovi garment. So Jovi is really great with fibrosis. It's also really good for limbs that are very heavy. You can see that CDT works and it's amazing, but it also does leave the patient with almost what we call deflated skin. So there is a lot of tissue that's just hanging and it's very heavy. Many patients choose not to have surgical intervention to correct and get rid of some of this excessive tissue. So we have to find alternatives for them to deal with this heaviness that they have now that they've gotten rid of the fluid, but they still have the skin and tissue that's there. So you can see in patient 1 and patient 2, they both have very large upper arms. They do wear a flat knit garment during the day, and Jovi would be an ideal garment for them at night. We can also custom make Jovi so that it's tailored specifically for these patients. These patients may need a zipper to kind of bridge the gap. They may need different options that are available with a custom garment. Patient 3, you can see, is a lipedema patient. Some of the studies that I read through have talked about using nighttime compression for lipedema patients. Even a study that was done with Relax, there were patients, lipedema patients, that also used the Relax garment. However, I do believe that Jovi is probably a little more appropriate for many of the lipedema patients. However, I think a Relax garment could also be used with lipedema. We're not going to see a dramatic reduction for many of these patients who are a straight lipedema patient. And as you can tell by this patient, she has no swelling in her feet. She is really a classic lipedema patient that the swelling starts right there at the ankle, kind of goes up to the iliac crest. Patient number 4, however, does have a lot of swelling and has fibrosis and has suffered from some cellulitis bouts. So this patient would be ideal for a Jovi. Even if we get it on one leg at a time, because many patients who have to use bilateral nighttime compression find it very difficult when they're in a foam garment. So what are our goals? What are we trying to accomplish with each patient? Well, we want to give them a home program that's manageable. But what outcomes do we really want to have? We want to have no increase in their swelling, ideally. But we also want to be able to deal with swelling as it happens throughout the year for these patients. Ideally, we're looking for no deterioration in skin or tissue integrity. Those changes mean they're moving into a different phase, and we're trying to avoid that. We don't want a deterioration in their shape. Those changes in shape make it more difficult on the patient in terms of mobility and maintaining their reduction. It also usually means that they're going into another stage of their lymphedema as well, which can create other issues. So we want to improve the patient involvement and self-management. That's really critical, is to get the buy-in. But they also need to know they need to continue to follow up with their lymphedema therapist. I think that's really important, is that one session or that one phase of treatment doesn't necessarily mean they're done. It just means they've hit a point where you can send them home and they can do home maintenance. I think here in the US, we need to do a better job reminding patients that it's okay to go back and get more MLD and to kind of check in with their therapist on a regular basis so that we can keep their condition at the most manageable point. Thank you all for attending. I really appreciate it and hope you found this very useful.